Good morning. Thank you. So I'm going to be describing for you today an external evaluation of a community-initiated project called a food hub. So for me, this is the first study that I've ever conducted where I had no say or no influence in the intervention itself. So I'm completely an outsider in conducting the study, which has both some strengths and some limitations to it. And I'd like to acknowledge my co-investigators as well. This opportunity came about through a funding mechanism that started in 2012 through the National Institutes of Health, designed for this very purpose, to have a rapid response, to be time sensitive, so that these kind of naturally occurring community-based projects could be evaluated. So as you've heard previous speakers discuss, there is some cross-sectional association that has been found between various measures of low access to healthy food in communities, usually measured as something to do with supermarket proximity, density, sometimes fast food proximity as well, which has been associated cross-sectionally with the number of behavioral and health outcomes. But certainly not all studies have found this association. So the cross-sectional data are mixed. And there's been a call for better evaluation of these community and environmental interventions because we know the local foods movement is growing rapidly and there are all sorts of gardens and farmers markets, and there's just no data to let us know what impact, if any, they may have on food access and on behavior. And concurrent with this literature is the food desert concept. So for those of you who aren't familiar, the definition from the U.S. Department of Agriculture for an urban food desert has to do with 20% or more of residents in poverty and 33% or more of the population who live more than a mile from a supermarket, and that's at the census tract level. And these tracts nationwide tend to have certain characteristics in common, although this sort of breaks down in large northeastern urban areas. So there's still some conversation about this concept. Is food desert sort of a distinct phenomenon, or is it just another measure, another indicator of poverty and deprivation, social inequality, what have you? So there's already been a policy response to this interest in healthy food access. The Obama administration created the Healthy Food Financing Initiative, which provides loans for retail grocery in these communities of low access and high poverty, and community economic development grants. And sort of the underlying assumption is that you fund these new venues for healthy food, and this results in increased access, which leads to improved diet, and so forth, with ultimately less obesity and better health outcomes. But another assumed outcome is that this funding will lead to job creation and a stronger local economy. And interestingly, the group funded in South Carolina through HFFI have only been charged with evaluating the economic outcomes, not the health outcomes, which is interesting to me, and I can only imagine the political conversation that led to that. The project is called the Harvest Park Food Hub. It's in the upstate of South Carolina. A complex has been built, is almost ready to open, that's centrally located in a community that they've identified as their service area, which includes 3 food desert census tracts. That's the USDA designation of food desert. And it has a number of components, a lot of moving parts in this project to keep up with, and we are focused on the ones that are highlighted there. A grocery store, a local farmer's market, an urban farm, a mobile produce market, and incentives to spend your SNAP benefits, or food stamps commonly called, at the farmer's market. So the research aims, we want to evaluate the impact of a food hub on the primary household food shoppers' fruit and vegetable intake, weight, energy intake, food shopping behaviors, and perceived healthy food access. And of course, we're investigating a number of other measures as well, but these are our key outcome variables. And also to conduct a process and context evaluation to assess the intervention's reach. Who's coming to the food hub? Is it the foodies or is it the people from the surrounding neighborhood? The exposure of residents in the community to the food hub, do they shop there? Does that increase over time? How often do they come? How much do they spend? The implementation fidelity, you saw that long list of components. In the end, what actually gets implemented and what were some of the barriers and challenges that may have led to alteration in the original plan. Compatibility within the community. Do people in the surrounding neighborhood perceive a need for this? Do they feel that it's being developed for them? We don't know the answer to that, but we hope to learn that. And we want to look at a lot of those systems level factors that could be both facilitators or barriers to the success of this project, including any number of confounding factors, some that we can guess at and some that we probably have no idea are there. We're using a non-randomized mixed methods evaluation design with a matched comparison site. We plan to do 3 periods of data collection. We've just finished the baseline a couple of months ago, so I have just a little baseline data to share with you today. And then repeat the measures after the food hub has been open for 1 year and for a second year. The delayed post-test was at the request of the community. They were afraid that it would take them longer than a year to see any sort of measurable change, and the grant reviewers liked this idea as well. And during this entire time, we'll be doing extensive qualitative and quantitative data collection to evaluate the process and context of the community and the intervention itself. So here's our setting. The intervention site includes 4 census tracts, which I've named A, B, C, and D. This is what the grant proposal that the community submitted for their funding identified as their service area, their target area for this project. 3 of those have food hub designation, A, B, and C, and 1 does not. As you can see, these census tracts in both the intervention and comparison sites are predominantly African American, except for 1. The high percentage of households that are below the federal poverty level, this is the state level. All of these are much higher than the state. Percent of households without a car, and this has been discussed. This may be the key issue in food access. Maybe not how far the grocery store is away, but whether you can get to a grocery store. And so this is quite high compared to the state. In the state, 7% of households don't have a car, and in these tracts, it goes all the way up to 59%. Percent with low food access, this is the food desert designation, and of course, this tract D is above 33%, so that's why it doesn't qualify. They're somewhat similar on obesity, and this is at the county level, and in fruit and vegetable consumption. So our methods and measures, we have completed recruitment and enrollment of our main family food shoppers, who are our individual level participants. That occurred during November through April, minus weeks around the holidays and winter break at the university. And our main recruitment strategies included mailings to all residential addresses in those census tracts, as well as community outreach recruiters who were paid employees of the project, but who live there and already have connections in the community. And we used a number of different venues and strategies. Data collection with the family food shoppers includes an in-person interview with a number of psychosocial, behavioral, and economic sorts of variables, height, weight, also self-reported physical activity. And then within a week after that interview, we're doing a telephone-based 24-hour dietary recall. So here's what the enrolled people look like. I'm sorry, this is the setting. I went backwards. So for our process and context evaluation, as I said, a number of qualitative and quantitative methods. We're going to talk to people in the community, get their impressions of issues around food access as well as the food hub. We're going to do some shopping food cost comparison between the food hub and the main grocery stores that they already shop at, tracking the implementation, and looking at, through a time series analysis, change in purchases at the food hub as it's implemented using SNAP or food stamp benefits. We're also doing another component of this study, which is a GIS analysis. We have geocoded, ground truthed all the grocery stores, markets, and restaurants within a 1 mile boundary outside of our recruitment area. So who are these family food shoppers? I am thrilled to say that we managed to get pretty comparable people in our intervention and our control group. We had no way of matching at the individual level, but we got a pretty good match at the community level. And so even those attributes on which they are significantly different, the size of the difference is not that large. They're a little older. I'm sorry, I keep using this as my pointer. They're a little older than I thought they might be. There are some retirement communities in both areas, but the percentage of households with children is right at the actual level in these census tracts, which is around 30. Mainly women, because it's food shopper. Very high African American residents, no difference on educational level, no difference on BMI category or mean BMI, and no difference on income category. I want to point out that nearly half of these households have income below $10,000 a year, which is extreme poverty. And in terms of economic variables, the majority received SNAP benefits in the past year. More than half do not have a car to get to the grocery store. They have to get a ride or pay for a ride. In terms of food security, at the household level, low or very low food security is quite high. The national percentage is 14%. And for children, for households with children, child's food security, as reported by the parent, is 32 and 39% in the two locations. Nationally, that's about 10%. So these are areas of extreme deprivation. So, sorry, I don't have any data for you. We're just finishing up year one, and in fact, I haven't looked at the dietary recall data yet. I can't wait to get it. But I want to share with you some of our successes and challenges. We met our recruitment goal, which was nothing short of a miracle. And in fact, we exceeded it by 33%. So we have some room for attrition, which we expect could be large in this population. We're in the process of recontacting our participants for retention purposes, and we've been able so far to reach about 80% of them, and we have a few weeks yet to go on that. We achieved fairly comparable groups that are also fairly comparable to their community census tract. We've had very supportive community partners, which was essential in a project with such an abbreviated startup period. Some challenges: most of our people have the government subsidized cell phones, and when they run out of minutes, there's no minutes, maybe for 2 more weeks until the next month, so you can't reach them, which wreaks havoc with your dietary recall schedule sometimes. But we got over 80% participation in the dietary recall as well, and within our time frame. But you can't do a random digit dial on those cell phones. They're like burner phones. There's no way to sample. There have been construction delays, and as I mentioned, known and unknown confounders. And also, there's no guiding theory or framework for this study because it wasn't created by behavioral scientists. It's a project coming out of the community. So we've had to think deeply about what is it we're going to measure, what are our covariates, and what are important outcomes. So lots of people to thank, and I'll open it up for questions or comments now.
So right in Columbia, downtown, we have a very active food market. And if you attend that on Saturday mornings, you see, I would say generally speaking, the people who go to the farmers market look like foodies, as you described.
Yes.
I guess myself included. So is there a potential obstacle as it relates to the perception of these individuals of what this food hub is going to be like and how that might perhaps be a deterrent for them going to the market?
Well, I suspect that, but we're going into our qualitative phase now. We're going to be asking that question, interviewing some informal community leaders, as well as having some focus group discussions with people in the neighborhood. So I don't know, but I do suspect that could be an issue, and that there will need to be some intensive outreach on their part. Of course, I'm itching to tell them what to do, but I can't do that. So, yeah, that's one frustration of this project. I can't be an advisor to them.
Hello. You had extraordinary participation proportion, and could you speak more about how that happened? Like, was it your collaboration with community partners? So, you know, you had a lot of people who joined your project, and can you speak more about how you were successful?
Yes. We had a big burst. We did a mass mailing of all addresses in the census tracts right away, and we had a burst of calls. And then it slowed down. And then we started doing other things. We sent home flyers in children's book bags, and we went on the TV, and we just did a number of things. And we would have little blips across time, which we've actually graphed, but I don't have that today. But I think the thing that brought us over the finish line, because we were nervous there for a while, we did another mailing in which we listed the names of community leaders who recommended that you participate in this study. So it said all the same things as the first flyer, but then it said, Reverend Smith says, Mrs. Jones, the director of the community center, says, this is a trustworthy study, you should take part in it. And then that was all it took. And so that, I think, was a key ingredient for us. Because people were skeptical, they didn't know if it was a scam, and some of them said, oh, I thought this was a scam. So I guess the university doesn't have much credibility in these communities, but local people do. So they were key.
Ed Frangillo, South Carolina. Patricia, you said at the end that this wasn't theory-driven, but I'm wondering, based on what you know now, what do you think are the likely pathways through which the program would have an effect, if it has an effect?
Well, what I think would be fantastic, I mean, I'd be amazed if there's any measurable change in weight. I mean, I'll just say that. I don't think, you know, with all of the complexity that everybody's talked about and the person and environment influences, it would be a miracle if building a food hub has a big impact on weight or obesity, but it could increase their fruit and vegetable intake. And there is some data to show that people in low-income communities will shop at a farmer's market if it takes SNAP benefits and if they have transportation to get there. So we don't know. Now, will they do that instead of their weekly trip to Walmart? That's yet to be discovered. But what we have tried to do is look at sort of a systems model of the food environment and try to measure potentially influential variables at each level that may be influential. I'd be happy to share that with you. Well, I'm out of time. Thank you.